So what's the difference between social media and traditional media? So almost in a very simple way, the traditional media is a one-way thing, whereas social media is two ways. Traditional media puts up information, we read it, we consume it. Social media is a two-way thing. When traditional media puts up information, we then engage, comment, like, spread, share that information. And secondly, it's a two-way thing, so we can produce our own content and broadcast it and put it up. So right now we're going to talk about blogging or having a website. And again, having a website is one of the first places, or a website is one of the first places that patients will go to find you. When your patients look up Dr. So and so, what will they find? Will they find a Yelp review or RateMD review, or will they find your website? Setting up a website or a blog is pretty simple. There are multiple different platforms: Weebly, Blogger, WordPress, and you can set up a very simple website page, a landing page, again with a similar content from Facebook and LinkedIn as well, but with additional stuff. I'll give you an example of a very well resourced group, the Farquhar ENT group. They've got lots and lots of information about their practice, but also they regularly add information about medical conditions that pertains to ear, nose and throat surgery, velopharyngeal insufficiency, nasal video on nasal hump removal or a nose job, biopsy for head and neck cancer. They have lots and lots and lots of resources. We talk about earplugs and other things like that, risk factors in throat cancer. Now, these guys are obviously very well resourced to produce a lot of this content, and that's great. For a single solo practitioner who may not have all that content, what can you do? Well, I've set up this website with only $34 per year of actual domain name. So I've bought my name as a domain name, and in a very simple way, I use a pre-made template. I have a page that basically says about me, another page of personal blog, and a page for patient information. On my homepage or the about me page, I essentially put a summary of who I am, what I do, my specific interests, and my previous public appointments. This is essentially the essence of the detailed information that I have on LinkedIn. And with regards to the blog, what do you do? Again, I've mentioned this already. You can write 250 words right now on a common medical condition. You can write 250 words right now on the most common thing that you see on a day-to-day basis. Anything, reflux disease, throat, sore throat, sinusitis, epistaxis, and that can be the source or the essence of your blog post. And you can write 250 words article once every 2 weeks, and that may be enough to keep an interest going. The other thing is you publish papers, so you can turn your abstract into a layman summary of what you have found in your study. My blog post, for example, the last post that I put up is on robotics in ENT surgery, and that was because I presented in my grand round the topic of robotics in otolaryngology. I essentially put a summary of my talk on my blog. There was an interview that I did with Sydney University Medical Student Society or Surgical Student Society about surgery. So I turned that interview into another blog post. Again, you have the content. You can just translate your scientific research into very simple layman terms. Or you can also get someone else to blog for you. You can ask another physician to write 250 words and you can put it up on your blog. So that's my personal blog. The other thing is with regards to patient information, I have taken off a lot of my personal patient information simply because I am a fellow right now, so I don't have a private practice. when I did have a private practice prior to starting my fellowship, I had very simple things such as ear tube instructions, perioperative care, where patients can essentially download um, a one-page note on postoperative care. That was what I did with regards to common surgery and perioperative information. So that's something that patients will find really useful. Um, that's with blogging. So just having that online presence, having that online information, and if even if you are not someone who produces a lot of content, you can always be someone that links your content to another blog or get someone else to blog for you. The information, every time I put up a new blog, I will then use that information as an entry to my Facebook page, and also similarly I'll be tweeting that out. So the information remains the same, but the way it is actually broadcast through Twitter, Facebook, and LinkedIn helps the dissemination of that information. Again, the essence is that I've only paid $34 for all of my social media accounts. The rest are all free. The investment of time, it's totally up to you. You can be present and be minimally present by just adding new information once in a while, or you can be really active and you can engage a lot of people on social media to improve your profile with your engagement with fellow doctors, physicians, allied health, and patients.